Hi, my name is Kat Lowengrub, and this is my podcast, Mental Health, a Topic Worth Talking About. I have been working in the mental health field for about a year now. I've worked in inpatient acute settings, hospitals, and treatment centers. I believe mental health is extremely important, and it doesn't get talked about enough. There's a lot of stigma surrounding mental health. People often believe that if they're diagnosed with a mental health condition, that it means they are crazy or they can't control themselves or something along those lines. And the truth is that's not the case. Many Americans and people all over the world have been diagnosed with mental health conditions, and it is extremely important to talk about so that we can reduce the stigma around it. In this podcast, I will be talking about my situation and my experience personally, as well as a couple of experiences that I've had with inpatient acute settings with specific patients. The first patient, and for sake of confidentiality, I'll call him Patient A. Patient A came to the hospital with extreme symptoms. Patient A was diagnosed with an eating disorder and bipolar disorder without psychotic features. Coming into the hospital, Patient A had not eaten in approximately a week, and anything they did eat, they were purging. Patient A is also diagnosed with bipolar disorder, so his moods swung a lot. It would either be super high highs or super low lows. There was no really in between. Getting through to Patient A was very interesting. The combination of an eating disorder and bipolar disorder is a unique combination. The thing is, with treating a patient with an eating disorder and bipolar disorder, you have to treat the eating disorder first, because if one is not being properly nourished, their brain isn't going to properly work. So if you treat the bipolar disorder first and would neglect the eating disorder, it will not fully get better because their brain isn't properly nourished. So with Patient A, I had to monitor everything that they were eating. And anytime that after they ate, they were required to sit with us for at least 30 minutes after the meal to prevent him from going to purge. This was pretty difficult because, if you can imagine, Patient A did not want to sit with us. And on days where the super low lows were occurring, all Patient A wanted to do was lie in bed. So it was a constant battle with getting Patient A to eat, 1, and 2, not throw it up, and 3, be able to sit with us and manage the emotions that were coming up at that time. So Patient A came in without eating anything, and throughout his stay with us at the acute hospital setting, the patient was able to increase their food intake without the use of an NG tube. And once their food intake was increased and the water intake was increased, we were finally able to address the bipolar disorder. In addressing the bipolar disorder, we treated it with medication, and as days went by, Patient A was remarkably better. By the end of Patient A's stay, Patient A was able to eat on his own, to manage the emotions that came up using coping skills, and to identify any trigger situations and to talk to the staff if Patient A needed help. It was a really cool experience to see. Now, I'll talk about Patient B. Patient B came into the hospital diagnosed with bipolar disorder with psychotic features. This is a unique diagnosis because the psychotic features can be very unique to the individual. So Patient B came into the hospital and he was hearing voices. The voices were command hallucinations telling him to do things. The reason that he came into the hospital was the hallucinations had gotten so bad that it told him to hurt himself. Inside the hospital, we were still dealing with his psychotic features, and we were treating that with antipsychotic medication. such as Abilify and haloperidol. The patient refused to take meds at first, and they had to be administered intramuscularly. But as the time went on and the medications were administered correctly, patient B got better. The psychotic features dissipated, and he was able to carry on normal conversations with us. It was amazing. Now, I talk about all this because mental health is an extremely personal topic for me. When I was 21, I was diagnosed with bipolar disorder with psychotic features, anorexia, OCD, PTSD, and depression and anxiety. It took me over 35 hospitalizations, treatment centers, and psych wards for me to finally become stable. I tried every medication in the book. I was on anything ranging from Wellbutrin all the way up to Risperdal. And it was really, really difficult. I was not getting better for a long time. But as I started to put in the work and I started to eat, I was able to actually get better enough where I could control my psychotic features and I could take my medication regularly. It was really hard. So this all ties together with the fact that mental health is not an end of the world diagnosis. In both of my patients, they ended up getting better and discharging from the hospital very successfully and went on to lead what I have heard to be very successful lives. And with my experience, it might have taken me a really long time to get through treatment, but now I have an amazing life. I'm a shift supervisor at Starbucks. I work at a treatment center, and I am happy. Thank you guys for listening. I hope that you have gained a little bit more insight about the mental health field and understood a little bit more walking through patient A and B's story. Thank you so much. See you next time.